Hi everyone, my name is Raman Deepkar and today I will be talking about secondary prevention. So the types of prevention to start off, we have primary prevention, which is basically intervening before health effects occur. Examples of this include vaccinations, improving eating habits, terminating tobacco use. Second, we have secondary prevention, which is basically screening to find diseases in the early stages before the onset of signs and symptoms. Examples of this include mammographies, regular blood pressure testing. Tertiary prevention is managing the disease after diagnosis to slow or stop the disease progression. Examples include chemotherapy, rehabilitation, and screening for complications. After this, I will talk about the importance of primary prevention. First, it reduces the prevalence and incidence of disease. It helps people live longer and healthier lives. It has the potential to control risk factors. It reduces the prevalence of chronic conditions, and it is cost effective. So obviously, if we're able to catch the disease before it progresses, we're able to save on costs for later managing and treating the illness because we're preventing it before it even occurs. So that's why primary prevention is important. Moving on, how can we reach the adult population? There can be some legislation for hazardous products. For example, everyone's talking about how vaping is really, really bad. Well, there could be banning on vaping, which would then prevent all the lung disease that is occurring as a result of it. Second, we can use social media and online tools to engage patient population as social media is on the rise nowadays. Next, we move on to setting up booths in hospitals' lobbies for education opportunities. Usually when you walk into a hospital lobby, you're sitting there for an hour waiting for your checkup and to talk to your physician. There could be stations set up, just one station downstairs of the hospital lobby where patients can go and they can learn some educational opportunities. Then we have ensuring regular follow-ups and care. It's important after you provide the initial care or education to follow up with your patient to see if they're following your recommendations. Using screening tools when the need seems present. If you feel that your patient is, for example, capable of committing suicide, you can use screening tools to see if they have any suicidal ideations. More thorough assessment of the patient in the primary setting. Again, that's to see if there's any underlying disease conditions. Increase provider education and training to detect issues. Sometimes the providers just don't have the knowledge and they might not detect someone that is in need of dire care. As I will be pursuing my career as a psychiatric mental health nurse practitioner, I'd like to focus on mental health for this presentation. The primary prevention in mental health, that refers to pre- and postnatal care visits to include psychological support and parenting skills training. Examples, managing the health of the mother and the infant. Home-based interventions that seek to promote mental health well-being. Funding of this is through the Affordable Care Act for home visitations. Other things are for individuals with early indicators of a problem, but they don't yet meet all the criteria for a disorder. So we're trying to catch them before it occurs. Next, we have secondary prevention in mental health. The aim is to reduce the progression of a mental health disorder once it has been detected through screening, early identification, and brief treatment. Settings include outpatient mental health clinics. Primary care providers are encouraged or mandated to screen for depression, anxiety, trauma, substance abuse. Greater numbers of individuals can be provided with timely care. Tertiary prevention in mental care includes focusing on improving functioning, minimizing the impact of an illness, helping to prevent or delay further complications for people with mental health disorders and illnesses, outpatient, inpatient, and home-based care to clients across the lifespan, broader access to care, and emphasis on care coordination. Some of the mental health screenings for depression in adults screening, it should be done for the general adult population, which includes pregnant and postpartum women. Depression in children and adolescents screening should be done in adolescents aged 12 to 18 years of age, children that are aged 11 years or older. Drug use illicit screening should be done in adolescents, adults, and pregnant women. Suicide risk in adolescents, adults, and older adults, the screening should be done for adolescents, adults, and older adults. Unhealthy alcohol use in adults and adolescents, screening and behavioral counseling interventions. These should be done for adults 18 years and older, including pregnant women, as well as adolescents aged 12 to 17 years. Intimate partner violence, elder abuse, and abuse of vulnerable adults. The screening should be done in women of reproductive age and older or vulnerable adults. Next, we have some statistical findings. 90% of the youth that attempt suicide have an underdetected or untreated underlying mental illness or at a risk of emergence of a psychiatric disorder, for example, schizophrenia, depression, bipolar disorder, anxiety disorder, or personality disorder. Anxiety and depression disorders are the most common complication of pregnancy and perinatal period, affecting 10 to 15% of women. According to the World Health Organization, harmful alcohol consumption is related to about 3 million annual deaths globally. We have some more statistics. Approximately 1 in 3 women in the United States experiences intimate partner violence. Substance use disorders are second to mood disorders as the most common risk factor for suicide. And substance abuse and mood disorders frequently co-occur, with 51% of suicide attempters having both. So that's more than half. Next, we have barriers in mental health prevention. So some of the barriers are stigma and discrimination. About 2/3 of people with undiagnosable mental health disorders do not receive treatment. Then we have financial barriers. People without health coverage have greater barriers to care, greater restrictions for mental illness, even with insurance. So sometimes even when they do have insurance, there's greater restrictions on mental health, and certain things might not be covered with the insurance. So even having it does not help. Mental health system barriers, so that's basically the interaction between the different centers for care, for transition from inpatient care to community. A lot of the patients, they get help in the inpatient and then they're discharged to the community. They don't follow up with their care. They don't, have regular visits with their provider. They're not reached out to make sure that they're compliant with their medications in the community, and hence they end up back into the inpatient unit. There's also there's lack of communication between primary care, specialty mental health care, emergency department, mental health care centers, substance abuse centers, and school-based programs. There's no integration or communication between these, which leads to a barrier in mental health. Next, we have communication barriers. So that is referring to the barriers with the patient. So the detection of the illness depends on the patient's willingness to communicate, as well as the clinician's ability to listen, recognize, and ask questions. Next, we have barriers in emergency care. So patients with covert symptoms are sometimes not recognized. This can be due to the lack of the suicide assessment guidelines, but also lack of training for the ED staff. Under treatment is the inadequate dose of antidepressants or medications. So even if the patient has been detected, their care, their treatment might not be adequate. Adolescents, some barriers exist in care for adolescents, which includes low access to care, low help-seeking behavior, low utilization of resources, problems with referrals, and non-adherence to care. Next, we're going to focus on mental health in the U.S. Issues that the United States faces in terms of mental health care. This includes increased elderly population with dementia and mood disorders. Increased veterans with physical and mental trauma are increasing in number. For example, a lot of the veterans have PTSD, which needs to be managed. Communities with natural disasters have large-scale psychological trauma. For people, who lost their family due to a tornado or a hurricane, they might need additional psychological support. Suicide is increasing in teenagers due to the influence of social media. There's lack of insurance for general population. There's 16% of the population which doesn't even have health insurance at all, and that number increases in ethnic minorities. There's stigma towards mental health, so there's just that it's okay, just brush it away as if it doesn't exist, but this is a growing crisis. New advanced practice nurses can help by providing thorough screening, which includes early detection, knowledge of warning signs, ensuring that there is regular follow-ups being done, ensuring that once care is provided, that there is the correct dosage of medications and the patient is compliant to the care given, regular educational services and referral services. And lastly, I will talk about some frequently used screening tools. There is a mood disorder questionnaire, the MDQ, which is a screening tool for bipolar spectrum disorders. It's a brief self-report screening instrument used to identify patients that will most likely have bipolar disorder. Next, we have the Montreal Cognitive Assessment. This is an increasingly used screening tool for cognitive impairment. It's a one-page, 30-point test administered. Takes about 10 minutes to go through. It focuses on things like memory, the executive function, attention, concentration, language. Lastly, we have the PHQ-9, which is a brief 9-item self-administered screening tool widely used to assess the potential presence of major depressive disorder or MDD. So that is it for my presentation, guys. Once again, I just like to state that mental health is growing in the United States, and it's something that we as advanced practice nurses need to be very aware of. And it doesn't matter what specialty we're going into, because we will all encounter patients that are in dire need of services related to their mental well-being. And that is it for my presentation. Thank you very much.